with our interfaith work, we try to find something that has of common concern, right? That we as a society know we can do a better job with chronic issues. You know, we can always help try to improve the environment. We can always try to reduce mass incarceration. I think one of our underlying issues as a society is doing a more effective job at addressing mental illness, but also creating a positive environment where there's better mental wellness. People feel more connected socially. They feel more connected with recreation. They feel more connected with their interests and how those interests can find common ground with other people.
When there is a crisis in the city or the community or even in the nation, when we all are concerned about the needs of other people, to mention that from the pulpit and break the silence about the emotional struggles and the mental and emotional needs of people that in response to great trauma. Another area in which clergy can break the silence is in that knowing that the suicide rate is so high here in Indiana for youth, of being able to pray from the pulpit for people who are depressed and struggling and having suicidal thinkings, that God would bring to them the people that they need the help.
We are often first responders. We need to be very aware of what our role is. Not only what our role is to help the person immediately, but also how to direct and support people who are under our care, direct them to people who are competent to give the help that they need.
So our goal is to bring together religious leaders in the community with people who have resources and understand the needs, and also who have mental health care provider training. And our goal is to then build that network of care and information and exchange ideas, learn what the faith communities are needing.
Because we lead very busy lives typically, so the logistics of getting together, being in the same room, having open and productive dialogues around mental health and mental illness, telling stories, sharing our personal narratives, those are the barriers we try to overcome with the Mental Health Coalition by providing luncheon opportunities to hear about a new resource or hear a new story or share a story and share some experience.
Many times it was a religious community that set up the first mental health facilities and hospitals. So we've provided that for a long time, both formally and informally, and some even in things like sermons, tried to promote positive, healthy living and being able to cope with things.
We are supportive of people who receive chemotherapy or other types of physical treatments. We have to be extremely supportive of people that are in need of psychological or spiritual care.
Create environments to where these topics can be discussed in an intelligent way. That's not threatening, but it is a uplift to everyone's understanding, so that we can begin to eliminate all of these social ills. And with those that can't be cured per se, but at least a misunderstanding can be cured.